Now, every year, hundreds of thousands of households in Kenya who would otherwise be in the middle-class bracket are dragged back into poverty due to unbearable out-of-pocket payments for health, particularly in cases of chronic diseases. But as Raquel Muigai now reports, the solution lies in health insurance, a necessity some Kenyans ignore.
When Winnie Ndegwa's curiosity took the better of her in June 2015, she had no idea what lied before her. A diagnosis that any other ordinary Kenyan would not wish for even on their worst enemies. Unlike many women, Winnie had taken a breast cancer talk on the radio with the seriousness it deserved.
I had a retro concern on one of my breasts. There was a retro dimple, so I thought it had been caused by the blur, because it had a placing support.
But her quest to know if she had cancer was a long one as she moved from one hospital to the next, seeking various opinions from medical professionals. And it was only after 3 months and several tests later that her diagnosis was positive.
You start calculating on so many things, on your family, on your children, on your life. Suppose it is like this, how will I start and all this, how long will I live and that kind of thing.
Upon her doctor's advice, Winnie had to move with speed in her course of treatment to ensure that the cancerous cells do not spread to other parts of her body. In November 2015, soon after she had undergone surgery to remove the tumor, she had to begin chemotherapy, a mode of treatment that many cancer patients have to undergo. But this came with a cost.
Before NHIF came, I have spent almost over $500,000.
This was after 6 cycles of chemotherapy, in which immunity tests after every cycle determined whether or not one would undertake the next cycle. Fortunately, through friends, she was able to sustain her medical bills, an opportunity that many Kenyans struggle to get. It was not long, however, when in May 2016, the National Hospital and Insurance Fund (NHIF) rolled out medical insurance cover for cancer patients. This time, Winnie and her family did not require another harambee to cater for the 25 radiotherapy sessions she was to undergo.
I actually translocated from Nairobi back here. Yes, what I was doing in Nairobi, I decided I can do it from here because to be near her.
The NHIF was established in 1966 under the Ministry of Health and has since been reviewed to help accommodate the changing healthcare needs of the Kenyan population. But with success stories like Winnie's, medical professionals agreed that the fund is making a step in the right direction.
So if perhaps the NHIF can bring on board all the Kenyans into the program, then it will improve its finances. And then that percentage, small percentage of those that fall sick can be able to walk in the hospital and out of the hospital free of charge. Also possible. It can also sit down with the doctors and so that we can agree the nature of the diseases. Because sometimes it may give too little money for a very major disease. So it is good that our medical boards and the NHIF sit down together.
For many like Winnie, NHIF has proved to be a blessing, saving them from losing family assets to offset medical bills. With universal healthcare being outlined under the Vision 2030, the National Hospital and Insurance Fund has a big role to play in making that a reality. Raquel Muigai, KTN News.